So the chronic pelvic pain and endometriosis in women have gone back ever since they had their first menstrual cycle. And this is something that, we don't have a lot of treatments for. We can place them on continuous birth control, Depo-Provera shots, which are they're pretty symptomatic, and sometimes patients really don't tolerate these medications very well. So if we try all these modalities and they're not really effective, Lupron shots they have a lot of side effects. So then we go back to what we used to do in the past, was doing diagnostic laparoscopies. Well, a diagnostic laparoscopy will look in there and say, oh yeah, okay, they have endometrial implants. Here it is, here it is. We take maybe a biopsy and then maybe burn a few lesions, and then we're like, okay, this is great. And then the patient feels okay for about 6 months, and then the pain comes back. And then they go back and do another laparoscopy, and then they burn a few more lesions, and then it's just this constant cycle. But now with the single robotic surgery, we can do more than just burn the lesions. We can remove all of them. And we're actually doing things called Firefly technology, where we actually inject a dye, and this illuminates all the hypervascular areas in the pelvis that have these endometrial implants that we normally can't see with the naked eye. So what we're doing is actually seeing these areas, and we're actually removing them, and it's a more aggressive therapy or treatment with it, but we're actually seeing better results because we're removing, i.e. the tumor, we're not leaving it. And sometimes you can burn a couple of them, the lesions, and it really didn't help much for the patient because it just kept giving this. We're actually seeing a really nice increase in fertility as well once we're removing these lesions and removing the adhesions and whatnot. And so that's a new procedure we've been doing.